Let's get started. Hello, thanks for joining me this evening. I'm Whitney Bruce, and I'm a UCSB alum, and I work in the Alcohol Drug Program. It's part of student health, and I am a graduate from the psychology department at UCSB, and I also got a coaching certification back in the day. And then I went on and got a master's degree in clinical psychology at Antioch here in Santa Barbara, and I'm licensed as an MFT. So I've worked in UCSB's student health since 2006, and I provide counseling and education for students. And I've been blessed to be able to work at UCSB for so long. I work with athletes as well at UCSB, and I find that to be a really fulfilling part of my work. I'm not a doctor, so some of the things we're going to talk about tonight, if you do want more of a medical background, definitely get in touch with one of my colleagues at Student Health. So I'm pleased to be presenting this info today. So here we go. I will go on to the next slide here. So Student Health, like I said, is the umbrella over Alcohol and Drug Program. And we're currently providing telehealth counseling, recovery support, and education by Zoom and by telephone. And harm reduction is really the way that we work with our students, and it's a really realistic way to help young adults cut down or quit, but definitely we collaborate with them to make healthier choices with their substance use. And harm reduction is basically getting people to recognize any kind of negative consequences or risky behaviors they might be engaging in and help them take steps to decrease that risk. So abstinence is the best for a lot of people, and we for sure support their decisions and help them with tips on how to do that. And, you know, moderation really realistically is fine for a lot of people as well. Motivational interviewing really is helpful in counseling to help people look at the pros and cons of their substance use. And these are the learning objectives for this evening. Understand how alcohol affects different people. Understand how behavior is influenced by alcohol. Sorry, this screen over here is getting in the way of me being able to read my own PowerPoint. Be able to distinguish between moderate and excessive drinking and how to be safe if you choose to drink, and know resources for cutting down or quitting. Now, alcohol is a very accepted part of our society, and in a lot of social settings, it's always there. So you can ask my old roommates from college. I know there were times where I ended up having too much to drink and had some regrets too. So there is that spectrum here. So I'll just briefly go over it. Abstinence obviously is just not drinking at all, either never done it or have gone back to not drinking. Experimentation is trying something, you know, once or twice. Recreational is more like, you know, you get invited to a birthday party or a wedding and you have a drink or two. Regular use is more like, you know, every Friday or every Saturday, or have a drink with dinner every night. Problematic use is more when you are actually having, you know, fights, arrests, losing jobs, you know, injuries, illnesses due to your substance use. Dependence is characterized by a lack of control, with limiting your drinking, as well as having a very high tolerance, and also having withdrawal when you do not have the substance. And that's certainly something where people will need to get some help to make those changes. So I've got a little video here, and I'll let you watch it. It's only 1.5 minutes. Hopefully everybody can hear it.
Most people know how they feel after drinking too much alcohol, but if you want to make an informed decision about drinking, it's worth to think about the path, content, or the last one, taste of your body. When you drink alcohol, it's absorbed into your bloodstream through the stomach and is not digested.
Oh, you can't hear it. Okay, sorry. Let's see, what do I need to do here? I need to share the, let's see, how do I get the video settings. Sorry. Okay, well, I forget what I have to do on that. Okay, well, sorry about that. Okay. I think we're going to have to skip that video, but let me go back. Sorry about that. Technical difficulties here. Okay. Okay. So just speaking of moderation. So what actually moderation is, the definition of moderation is having 2 or fewer drinks 5 or fewer times a week. And that's not normally how college students drink. Usually they're, taking off, their weekdays and then having a lot of drinks on the weekends. So, while some bigger guys can kind of handle more than, 3-4 drinks, if you're smaller, if you're female, you don't have as many enzymes to break down the alcohol, and the alcohol will really affect you, and you can have some negative consequences from that. I'm going to go through some of the actual organs here and how alcohol affects it. Normally, healthy people are able to break down moderate amounts of alcohol. And when you do drink, about 20% of it is immediately absorbed through the stomach lining into your bloodstream. The rest, the 80% left, is absorbed through your intestines. So the liver breaks that down about a drink an hour. And the bloodstream's content of alcohol rises the more you drink, and the effects are felt more normally. And this is your BAC. So step by step, what I've witnessed with college students is that, when they do drink too much at night, they forget to brush their teeth and they have tooth decay. Longer term heavy drinking causes more chronic problems, like the chronic salivary glands not working, and then you've got more porous area in your mouth for the toxins to get in and cause some viruses and things like that. So gum disease, eventual loss of teeth. And then with your throat, there's some longer, heavier drinker problems here. The alcohol irritates the mucosal lining, causes inflammation. The lining is thinned, and that can contribute to ulcers. And the esophageal sphincter is weakened, and that can lead to heartburn. Chronic changes will happen in esophageal cells with long-term drinking, and that can actually cause, things to get in there, even carcinogens, and you can have some cancers that will actually cause death. Bleeding due to vomiting, that's all this acidic acids that are getting into that lining and really causing it to hurt. Heartburn is an issue, and I think because the stomach is causing so much more acid, there's more acid that's splashing up into the esophagus. People tend to eat spicy or sugary foods, maybe late at night, and then when they lie down and the sphincter is loosened up, then that can splash that food back up into their esophagus. And the stomach, the mucosal lining is broken down by the acids, so the burning sensation can occur there. People can have that gastritis that comes from that, which is an inflammation of the stomach lining. And if people do develop ulcers, it's very hard to heal from those because of the acidic nature of the alcohol. So it affects your circulatory system, and that alcohol gets into your bloodstream, it goes to your brain, and it raises your blood pressure. And even though it is a depressant, there is a mechanism in your brain that's telling your blood pressure to spike up. So arrhythmias can occur because of that. And usually what we hear from the students is that the next day after drinking, they feel their heart racing, and it's this effect from the withdrawal of the alcohol. they might feel a lot more anxious when they feel their heart racing like that. And long-term excessive use can cause cardiopathy. And that's noticed by shortness of breath, fatigue, weakness, and swelling in the extremities. All right, so parts of the brain that are affected. The cerebral cortex, that's, the main layer over your brain, and the reasoning and the logical part of your brain are out the window when you drink too much. So people are acting much more spontaneously, not really thinking about the consequences of what could happen. That's where we see people just, making poor decisions. The cerebellum is the part that is going to inhibit the fine motor skills from working, and also will make people have slurred speech. And law enforcement definitely is noticing these things as they might be evaluating somebody for a DUI or something like that. The hypothalamus and the pituitary gland, those are going to be affected by increasing sexual desire, perhaps, but the sexual function decreases, and we're going to talk about that a little more. And then the medulla, that's where your heart rate is decreased, the core temperature is decreased, but your skin may actually feel warmer due to vasodilation. And students like to call that beer blankets. They don't notice they're getting cold, but their core is cooling down as they drink. So blurred vision is another effect of being under the influence, and that can be something that becomes more long-term, and even in the absence of alcohol, with long-term drinking, that can actually impair the visual neural circuits. Same with hearing loss. Long-term drinking causes damage to auditory pathways and can result in hearing loss. So super important for students, for everybody really, is focusing. And there's so many distractions these days. And before the age of 25, substance use is really impactful on how brains are developing, particularly with reasoning and emotional areas, but this attention and focus is very much affected by the drinking. So what they've noticed is that there's a difficulty distinguishing between relevant and irrelevant stimuli. So that could be, sitting in class and not noticing, or not listening to a professor and noticing everything else that's going on in the room. And so it looks more like ADHD if they really are having issues with how much they're drinking and not getting that full night's sleep that you really need to restore your brain functioning. So they can't pay attention, and then can't really access memory as well either. All right, alcohol's effect on mood. So there's this thing called the biphasic response. So the typical first response to drinking to about the 0.05 BAC, which is about a drink, is mild euphoria, that feeling of being buzzed or lightheaded. And then the depressant effects kick in after that. So the more you drink, it's not the better you feel. The more you drink, the more emotional you're going to feel. You might be more fatigued because of the depressant effects of the alcohol, and less coordinated, and not able to really control what your moods, what you want to control with your moods. And not everybody responds the same way to alcohol. Chemistry differs from person to person, but in general, serotonin and dopamine are affected by drinking. Personality changes, I put this picture of the Hulk. If you're as old as me or older, you might remember this TV show where when David Bannister gets angry, he gets like enraged and turns into a green monster. So I thought it was a great picture there. All right, well, after a night of drinking, someone might fall asleep a little quicker, but won't stay asleep soundly since the body is really rebounding from alcohol's depressant effect. When someone's drinking, alcohol inhibits glutamine, one of the body's natural stimulants, and when they stop drinking, the body tries to make up for lost time by creating more glutamine than it needs. So the person especially is sensitive in the morning to light and sound. So they can't really sleep in and get a good night's sleep, and they probably stayed up really late. So resulting fatigue due to that. So regarding sex, a lot of social settings, you know, where people are meeting and they might be including drinking. So this might be helpful for some people who are very introverted or shy, who feel that they get their wings, you know, or they get more emboldened to meet people. So that might be something that people start relying on alcohol for that, which is kind of not a great way to learn how to socialize, but so alcohol lowers inhibitions, that's well known. However, and they might initiate sexual contact without as much awkwardness. However, the actual sex is impaired by this. Sexual functioning doesn't work quite as smoothly as they think it should. So alcohol dilates blood vessels, there's less blood flow to the sex organs, and there can be erectile problems if somebody's really drunk. And in long-term heavy drinking, there can be erectile dysfunction for men. Nerve endings are less sensitive, and there's less vaginal lubrication if someone is dehydrated. And it can also interfere with your ability to climax. And then psychologically, you know, there's what we see in our counseling offices, or people are sometimes in despair over what happened when they've been under the influence and had either unplanned sex, unwanted sex, they regret the sex they had. They might be, you know, fearful that they could have gotten an STD or cheated on someone or gotten pregnant when they didn't want to. And all these things can really contribute to how anxious they may be feeling. What they really want is to have a good experience that they remember and felt, you know, when they're having sex. So let's face it, hangovers, they suck. Headaches, nausea, even maybe feeling still drunk the next day, feeling really fatigued the next day after not having a great night's sleep, maybe staying up too late, being off that sleep schedule. And the reason this happens is because there is, number one, an inflammatory response from the immune system, and the cytokines are, you know, ramped up in your system. The stomach lining is irritated, and that causes nausea and vomiting. Blood sugar is low, so you drank, you know, in the evening, and that was a lot of calories and sugar that was in your bloodstream, and then you don't have that the next day. And your blood vessels that have expanded, and you have dehydration, it's causing the liver to work less efficiently. So your body is just kind of like feeling pretty sucked up at that point. And the headache is really due to dehydration. And then what I've heard, and I should probably look more into this, is that your brain is kind of shrinking away from your skull. So that's not a very nice image. So yeah, and the only thing that can, you know, really helps with hangovers, I mean, I know that it's been said that you can have a nice greasy meal, but you really need to hydrate and get your salts and all your electrolytes and your serotonin and your dopamine back into the right levels. So more on anxiety. What is up with anxiety? I mean, there's a lot of things to be anxious about right now with COVID and racial relations and all the other things that are going on right now. And I think for students just trying to juggle, especially with having, you know, distance learning and trying to keep in touch with people and not sure if they should go home for holidays. I mean, there's a lot to be anxious about. And, you know, what's happening in the brain, your brain is perceiving this danger and sending out those fight or flight or freeze signals. And that, you know, the serotonin system can get pretty jacked up, and people with anxiety disorders, they have a big reaction to the stress, and they could have panic attacks as a result. So, you know, sometimes even traumatic memories can trigger some of these reactions. It might seem natural that somebody would want to use a depressant like alcohol that's just so, you know, frequently used, but a lot of our students do say that they feel extra anxious either, you know, a little bit after drinking or just the next morning, they're just feeling really flooded with anxiety. And so it's just a very temporary fix to have those drinks on a night that they might be feeling anxious. Also, sometimes those students might be taking an anti-anxiety medication, and that can be really dangerous to be mixing something like, you know, Xanax along with alcohol. They can cause blackouts pretty quick. So there's basically a withdrawal effect from the alcohol the next day. And so they are feeling kind of that flood of that cortisol in their system. And then for people who are like long-term heavy drinkers, if they have withdrawal from that alcohol, if they try to just not drink, they can really have trembling, seizures. They can even die from those seizures. So medical detox is really important for those people that do drink every day heavily. And then, of course, there's consequences from situations that come up while they're under the influence that cause there to be a lot of anxiety. And then depression. I mean, like I said before, alcohol is classified as a depression, and as a depressant, it decreases your nerve speed and activity, and the actual dopamine reception sites are reduced if after years of drinking. So the brain, they've done these brain scans that show that people who've been drinking a long time, the brains have actually shrunk, so they have less neuronal activity. And there is a genetic predisposition for people either both with depression and with substance use disorders. So it's just important for people to know their history and know about family members that have had these disorders. Let's see here. People with alcohol use disorders are 3.8 times more likely to suffer from depression. And then the antidepressant medication doesn't work as well if people are drinking. And taking that depression a step further, according to addiction resource research, young adult drinkers, they don't always have a history of consequences from alcohol and might not really know the dangers of over drinking. And, you know, depression is typically being diagnosed around the same time as people are coming to college. Suicidality rates are highest in, you know, in the 20s, in people's 20s. So even though it's not common to drink themselves to death, often people who are suicidal, they may be using alcohol to, you know, either they've been thinking about suicide and then they use alcohol and then they just don't hold themselves back because they're acting very spontaneously and impulsively. Or they might even be using alcohol to numb the feelings of pain for when they actually are trying to kill themselves. And then there's some research about students with problems relating to alcohol and intimate partner abuse being more likely to develop suicidality. So we really want these people to reach out and get some help from their support network and professionals as well. So problems with elimination tend to come up the next morning. People might notice that because they've had so much fluid, they might have diarrhea, their gut is just flushing out. The muscles of the intestine are actually working faster to push out waste when they have more volume. And there's irritation in the gut, inflammation, and they are more susceptible to infection because of that. People who have irritable bowel syndrome, Crohn's, and colitis can have flare-ups from drinking alcohol. And dehydration causes constipation, so that's not going to be great for people. And as far as eating disorders, I mean, people diagnosed with bulimia, they struggle often with controlling those impulses to eat, and a lot of times, you know, it's an emotional issue in which they are eating and kind of feel that sense of being out of control at that time. A lot of times that's their drinking style as well. So those people might have a hard time stopping after 1 or 2 drinks. And that can really lead to blackouts and other issues. Sometimes blacked out, they might even binge during the time that they've been drinking a lot. And those people who are restricting calories, they a lot of times are very conscientious about how much they drink. They really want to make sure that they're keeping their drinking very, very low. And there is a risk in if you haven't eaten all day and then you do drink, that is going to affect you very quickly. All that 100% of the alcohol is going to get into your system very immediately. And then this term drunkorexia is, it's a pop culture term, but basically it means that some people that are really watching their caloric intake, that they might cut back on what they eat during the day so that the calories that they drink and the alcohol later in that day will kind of balance out. However, that doesn't really take into account that you're not getting any nutrients that you need. You don't get as much nutrients that you need, and alcohol does interfere with being able to absorb those nutrients that you need. The liver's job is to filter out toxins from your bloodstream. And when someone with a healthy liver frequently drinks, their liver actually makes more enzymes to break down that alcohol. And that contributes to tolerance. So people might not feel that effect of the alcohol after 1 or 2 drinks because their tolerance will increase. And that can actually be a problem because, that they might start drinking more and more and more. That can start, wearing down their organs and also could create a dependence. So this is how it works. Basically, alcohol dehydrogenase breaks alcohol down to acetaldehyde, a toxic metabolite. So that's what makes you feel really crappy. Another enzyme, acetaldehyde dehydrogenase, breaks the acetaldehyde down to acetate, and the acetate's not toxic, so that's good. For those people that are trying to abstain from drinking, they might try this antabuse. It's been around for decades. And what that does is it blocks the ability to metabolize the alcohol normally. And the person who takes the antabuse and drinks on top of it will feel really sick. So they will have all those symptoms of a hangover like immediately. So if somebody with a healthy liver actually stops drinking, their tolerance will decrease. So that is something to keep in mind. And sometimes we see that with our students who, they go home for, the winter holidays and they don't drink at all. And then they come back to school, and the first weekend back, they go to a party and they have, what they used to drink before. And this time that amount, they just blacked out and they don't remember anything that happened. Because their tolerance has gone down so much and their enzymes have dwindled down. So a little bit more about the liver. There's more than one type of alcohol dehydrogenase. And for example, a lot of people ask about why they flush when they're drinking. And they probably also experience hangover symptoms a lot quicker. And it's called alcohol flush reaction. About 50% of people of Asian descent, as well as Ashkenazi Jews, they lack that ADH2 enzyme. Some students say that they take Pepsid AC or a histamine to try to not have that flush reaction, but it turns out that really only helps with the way the skin looks rather than actually metabolizing that alcohol. So it's important to know that if they're looking for the flush to say that they need to stop drinking, they might not see that flush. And liver damage happens with a lot of years of heavy drinking, fatty liver disease. It's like when those tissues start just becoming fatty and not being able to work, the muscle breaks down. And it can be reversible after a couple of weeks of abstinence, so that's good news. But with long-term heavy drinking, there's inflammation, there can be scarring, and even hepatitis. And cirrhosis of the liver can start occurring after around 10 years of heavy drinking, and that can't be reversed. So cirrhosis is something that just, is eventually going to lead to liver failure. And like I said before, it's really toxic to mix other substances with alcohol. Acetaminophen is very toxic. And what we see with students who have mixed you might not understand the effect there. It could be this synergistic effect. So, you know, there's the possibility of having a downer with another downer. So alcohol with an opiate, and they might black out very quickly. They might overdose, need an emergency response. They might end up needing to, they might end up overdosing and dying. And unfortunately, we've had students that have passed away because of this. And then also mixing a stimulant with alcohol can be really risky as well, because people might black out thinking that they're not that drunk because they're still feeling stimulated, and then just end up doing something very risky or even overdosing because they'll continue drinking. And I was reading something about how particularly young women are having alcoholic liver disease more frequently than they were in the past. So some of the symptoms of the liver breaking down are chronic fatigue, decreased appetite, abdominal pain, and swelling. And kidneys, it's just another filtering organ that we have, and they have to work really hard to get the alcohol out. And you know, they're trying to help us be hydrated, and kidney diseases are much higher in people who are heavy drinkers. In the pancreas, long-term alcohol use lowers the body's sensitivity to insulin and contributes to type 2 diabetes. So we often see students that are vaping or smoking only when they drink, and so their defenses are kind of down here. And you know, that's really, especially during these times of COVID, it can be really risky as far as the damage they might be doing to their lungs. So what's going on in there, you've got these little cilia that move the mucus up and down their lungs, and that clears out mucus and the bacteria that the mucus is getting out of their system. But if they damage that cilia, that stuff just sits in there and can actually cause infections. And you'll see lung inflammation, pneumonia with longer term use. Also, you know, what we've heard about is when people are really drunk, they might be passed out, and their high BAC impairs their gag reflex, and they might aspirate or even choke to death on their vomit. Image and social media presence are so huge right now, especially with young adults, more than ever, and can really affect their self-esteem to have skin problems. And alcohol definitely gets in the way of having hydrated skin. People's skin might look really puffy the next day after drinking. Redness and rosacea are common with longer term drinking, broken capillaries in their skin, and also can disrupt hormones. So there might be more acne due to their hormone disruption. They might have dark circles under their eyes. So these are things that students can actually see the next day. And I mentioned in some of the organs that they're just much more susceptible to cancer because the immune system is weakened by excessive long-term alcohol use. All the different organs that we've talked about are all much higher association with alcohol. So there is some good news. This is a slide that shows some brain scans, and I believe it's Dr. Amon's work, but this slide came from Daryl Inava's amazing lecture. He's a leading pharmacologist and addiction researcher in San Francisco, or he might be in Portland now. And this slide shows that there's a lot less neuronal activity going on in a brain of somebody who's intoxicated. But with about 30 days sobriety, their brain is showing more neuronal activity. There's less holes there in that side of the slide. So they're becoming more able to think, you know, all those different areas of their brain are able to function. More electrical activity. So there's just some ideas about drinking. The idea is, you know, make sure you eat something first so you don't spike up your BAC too quick. Make sure you're hydrated beforehand. Alternate alcoholic drinks with water. And then before going to bed, drink water. When you get up in the morning, I mean, just for anybody, not even drinkers, to have a glass of water is a great idea. Having a limit, kind of knowing yourself, knowing that, like, you know, if you're driving, you really shouldn't be drinking, that kind of thing. And being able to tell people, being able to communicate, hey, I'm not drinking tonight. Pacing yourself, you know, that 1 drink an hour is really the best idea. Taking days off, like maybe you don't drink, you know, Sunday through Thursday, and Friday you let yourself have a couple because you know that you don't have anything big to do the next day. And I think most importantly, not relying on alcohol to make you feel better emotionally, not relying on alcohol to, you know, get yourself feeling more confident, that you want to work on those parts of yourself before you have to use a substance to do that. And, you know, the idea is it goes along with an activity that you're doing, like meeting people or catching up with people or having dinner, going out dancing. During the pandemic, I see a lot of people, you know, having a cocktail in their backyard with a neighbor, being socially distanced, of course, but just keeping in mind that sometimes people's judgment is skewed during COVID times when they're under the influence, and they might forget about some of that the physical distancing that we need to be doing. And yeah, just some advice for people trying to cut down or quit. You know, number one, you know, avoiding some of those places and people that you drink heavily with, and telling those people, hey, I'm taking a break. Let's do something instead. Let's do something different, something that doesn't involve alcohol. Not buying alcohol, not having it in your house, just making it harder to get to the alcohol. I think it's helpful. I know you can drive to a store, but you know, sometimes you're too tired to do that. Using alternatives to alcohol, like making a fancy drink. It could be anything from, you know, sparkling water with some mint and some lemon squeezed in there, or even, you know, mocktails. Can be fun to do that. And people might not even notice that you're not drinking alcohol. So finding ways to socialize and, you know, having some structure and routine to your life is really helpful. Staying busy. If you're having, you know, cravings, you know, maybe finding some other kind of alternative there. Like maybe it's an emotion that you're kind of coping with, like maybe you're feeling lonely, and that's, you know, typically you reach for your beer, but instead, you know, you actually call somebody, call an old friend, call your mom, call, you know, your aunt that you haven't talked to for a while. And so I think just really being aware of why you want to drink, and being aware of what emotions might be coming up that are getting to you. Sometimes it's hunger, you know, people come home from work, and instead of opening a beer, you know, have something to eat. That might be helpful. But here's some different ideas too. GFR is our peer recovery group, Gauchos for Recovery. It's a wonderful resource for students, and they're doing their meeting. I believe it's still online, but I think they obviously want to get back to being able to meet in person. AA is a great resource. People have gotten sober at AA and just changed their lives, met best friends, met really inspirational people through that. And there are hundreds of meetings every week. Just look on their website and you can find any type of meeting that you want. Alternatives, Smart Recovery, Dharma Recovery, those are other alternatives for people who maybe don't necessarily like AA. Medication assisted therapy, MAT, that's helpful for people. I talked about antabuse, but Vivitrol, Camprol can be helpful. Off-label things like Topamax and Neurontin also have been proven to be helpful. Some people are using the term sober curious, so they are thinking about taking maybe you know, January off, or not drinking until Thanksgiving, or things like that. So for people who are interested in cutting down or being moderate, individual therapy can be really helpful. So working with one of our therapists at ADP, or, you know, finding a therapist in the community, and we can definitely, you know, suggest certain therapists that we know in the community that work really well with students or family members. So I guess the only other thing that I would like to say is that I do run a group for students who have a family member struggling with a substance use disorder. And it's been a really helpful group for students to be able to relate to each other and give each other support. It definitely resonates with them to be able to tell some of their experiences and have people understand what they're going through. If you do know somebody that might be appropriate for that group, we're going to start a new one probably the 3rd week of January. So these are my references here. If you would like to know some of the information that I talked about and which of these references I got it from, please let me know, and I can tell you exactly what matches what. And this is our last slide. I really hope you got something out of this talk, and I'm open to more discussion. I can stay on the line here for a few more minutes, but just know that the Alcohol and Drug Program is here for you. If you have any questions, it could be about a friend or a family member or yourself or a roommate, but we would love to hear from you. And we are doing telehealth right now, so keep that in mind, please. Check out our website. We've got a great website. Thanks so much, and good night.